Hello everyone, welcome back to 9-Star TV. Last time we talked about the migraine, and today we'll talk about the eyes problems. Eyes problems, there are many types of eyes problems, including the dry eyes, vision loss, blur vision, and eye diseases, including cataract or any type of eye disease, including blindness. The eyes problem, I think, most popular as dryness of the eyes. In any occasion, when I just ask how many people have the dryness of the eyes, more than half of the people will raise their hands, because the dryness of the eyes is so popular. Someone a little bit, someone a lot. Someone's one eye, someone's both eyes. And especially the people who suffer for a long time, they have to use the artificial tears. I asked them, do you have any treatment? Try any treatment? They said this is the only treatment they can get. There's no better solution. Then I said, how about, did you try acupuncture? Someone said no, someone said yes, but still couldn't get rid of the dryness of the eyes. For the dryness of the eyes, when we apply the needles, it's not apply the needles in the local. If you put in the local, all the related points, it will work temporarily, but it's not a fundamental cure. Because the fundamental cause is behind that. That's why we have to treat the root. That means that if you cannot get rid of the dryness of the eyes completely, you didn't find the root and find the corresponding solution. I have a patient. He came here with his wife. He was just a driver. His wife came here. Here is for the neck pain and shoulder pain. But when I make the diagnosis, I said, you have the dryness of the eyes. So she said, how do you know? I said, yes, from the spinal diagnosis. Spinal diagnosis is my special technique. I developed this technique just by the hands to feel the spine, can make the diagnosis to know what kind of a problem you have. So I was very sure she had dryness of the eyes or any type of eye problems. She said, yes, I've been suffering the dryness of the eyes for 3 years. It's very bad. I'm using the artificial tears. Before she finished the words, her husband said, hers is a small case. I've been suffering the dryness of the eyes for 6 more years, and it's very bad. I have to use the artificial tear every 10 minutes. Everywhere I go, I have to bring the artificial tear, otherwise I cannot open the eyes. So I have a hard time to do anything. Then I said, okay, I can confirm the diagnosis. I said, okay, I can do this. Since you are a driver and your wife, I give your wife the treatment for the neck, but I also give her the bonus of the dryness of the eyes, and also give you a free treatment as a bonus. Every time you come here, give you the needles and treat your dryness of the eyes. But after I treat your eyes problem, you can completely get rid of the artificial tear, but you have to be the testimonial, make the testimonial. He said, no problem, whatever you tell me to do. Then we made the deal. So I give his wife the treatment, treated both of the problems, and every time I give him one needle, and each time use just 1 minute to make him see the difference. The eyes get more moist and brighter and looser. So he was very happy. after the whole session, 30 minutes, he felt the eyes are really brighter. And after 7 sessions, his dryness eyes was totally normal. So he really made the testimonial audio recording, and I did play it in one of the talk shows, and but unfortunately that's in Chinese. Like the dryness of the eyes of many patients have the problem, and I can make them get rid of the problem. The other problems like blur vision, vision loss. I think many people have the blur vision. Of course, if you read too long, the vision may be blurry. But the blurry is just always there. There's someone even worse and just become blind or close to blind. I have a patient. He's the scientist, actually chemist in Stanford University. He's a researcher. He came here for his vision loss of the right eye. As the first time I tested, within 1 meter, he couldn't see the letters on the wall. But with the left side, he could see everything. With the right side, he couldn't see. He just saw the dots. It's dark, but cannot recognize the letter. I said, okay. I asked him, did you get any treatment? He said he tried any type of treatment. He went to the specialist. The specialist couldn't find any cause. So there's no solution. But the vision is degenerating, getting worse and worse. I made the diagnosis, spinal diagnosis, and confirmed. I said, I can help you. Then I gave him needles. So each time the same thing, 1 to 2 needles. I think mostly give him 2 needles. Then make him do the exercises. After about 10 minutes, I said, do the test. He tested. He found the eyes felt looser, but the vision couldn't tell the difference. So after the whole session, he said the eyes was better. The right eye was better. He seemed like he could see clearer. And the second time, when he came here after the session, he said I could recognize the outline of the letter. Then after the third time, he said I could recognize some of the lines. After the 6th session, he said I can recognize all the letters. He could read again. So he was very happy with this effect. And he still did the consolidated follow-ups. And eventually his eye was completely normal till right now. It's been 4 years, so it's been very stable. What's the cause for these eye problems? No matter which type of the eye problem, except the external injury or another related problem like the liver problems, there's a circulation problems. Then what's the cause for the local circulation problems? We find it's also related with the spine. In the vertebrae, C1 is the most case can cause the vision problem because the optical nerves are related with the C1. And when C1 is bigger, the first vertebrae, when it's enlarged or tilt to one side, they will cause the vision problem. And in the beginning, maybe just some blur vision or just feel discomfort. There are other getting worse and worse, degeneration, and eventually even lose their vision or the vision loss. So when we treat this problem, we have to treat the root. The root is from the back. So before, I did have someone have the different eye problem. I treated the local points, but the local points help temporarily. It's not the fundamental cure. Someone, the eye disease formed, so we have to treat both the root and the effect. That means the root is from the neck and the effect is the local. So we may put more needles, one needle like from the holographic needle in the scalp, and sometimes put on the hand, sometimes put on the tummy to treat the problem. They get the same effect. And then at the same time, if they have the internal problem, that's the liver problem or kidneys problem, we have to treat the corresponding organs. And someone, they get a local poor circulation, so we have to treat the local circulation. So vision problem, it's so popular and seems like it's so complicated, but as a spinal diagnosis, it's very, very simple, much simpler. And same as the other eye problems, including someone, the eyelid just dropping, they cannot open the eyes. This is the diagnosis called autoimmune disorders or neurological disorders or something. These are all related with two aspects. One is the neck, the spine. The second is the internal organs. So I've been treating this type of problems for several cases, like for the eyes problems, about 5 cases, but very, very successful. It's not so many, but they are very, very successful. The effectiveness is 100%. If they get completely treated, depends. Like one case, he didn't have enough confidence. He came 3 times and then he stopped. He thought, because he was so frustrated, he went to many specialists to try to treat the problem. His eyes are just like this. The right side is couldn't open, just like this. He have to lift it up, hold for a few seconds, and then come down again. The frustration made him really frustrated. Eventually, he just lost any confidence to follow up with the treatment. So his case is not successful, was not successful, but it worked. It really made him a little better. Just the process is slow. Like usually the other case is like the dryness of the eyes. First time, in first minute, you can see the difference. But I cannot guarantee this type. This type, within maybe first couple of sessions, you cannot see the difference. For someone, yes. Like the other case, maybe because of the age, maybe because of the degrees, and also related with how long they've been damaged for the corresponding tissues. But we can find the solution. At least I can assist to help you in certain degree. So mostly the eye problems, we can get the solution by treating the spinal problems, especially the first cervical vertebrae, C1. It's very, very successful. If you have any question, you can reach me by the phone number is 408-532-5567. Or you can search 9-Star University to reach me. Or nsuhs.org, also you can reach me. Repeat again, the telephone number 532-5567. Thank you. Have a great day.